big worry has been what is going on in Delhi. While the rest of India overall seems to be improving in terms of the COVID count, it's the opposite in Delhi. The good news is that the air seems to be better today, just right after the festive season, but that hasn't helped the COVID count completely. The numbers as of yesterday are 500 cases up. This while the all India new daily numbers have come down below 30,000 for the first time since mid-July. So while the rest of the country is seeing a drop in new cases, Delhi is seeing an increase. The situation is so worrying that the Chief Minister Arvind Kejriwal has written to the central government proposing a mini version of lockdown. Some markets could be closed. That's his proposal. He's also suggesting that the number of guests allowed to marriages and weddings ahead of the wedding season be reduced to 50 from 200, etc. Now, it's not clear whether it will come to that situation. Hopefully, it will not. But meanwhile, to get a better understanding of the medical scare and the crisis in that sense in Delhi, I'm joined now by Dr. Guleria, Director of AIIMS. Dr. Guleria, pleasure to speak with you here on the India Development Debate. Let me first ask you, are you worried that the festive season and the way people have behaved during the festive season will really undo all the advantage and benefit and progress we've made against COVID-19? Is that a worry you have?
So overall, India has made good progress as far as COVID-19 is concerned in bringing the number of cases down from what we had of close to 1 lakh cases. We now have less than 50,000 cases a day. But there are certain areas where there is a spike in cases, Delhi being an example. And that's related to multiple factors. The change in weather is one. But COVID appropriate behavior has also really become something that we are not noticing. And because of the festive season, there's been a lot of crowds which are gathering. And many of these crowded areas where people are not wearing masks and are not having physical distance can become a super spreading events. And it's likely that this is what has happened in Delhi, that we've had events where it could be markets, it could be some party, it could be some other function, which has become a super spreading event or events, and that has led to this huge spike of cases. So I think if we really need to sustain over the winter months a decline in cases and not sort of go back to what we go in the direction which Europe has gone, we have to be very disciplined as a population.
But why just Delhi? Is this restricted to just, something that could happen in Delhi? What I'm trying to understand is, could this not perhaps happen again in a place like Mumbai or in Kerala? Is it restricted to Delhi because of geography, location, weather, or any specific reasons?
Not necessarily. The weather does contribute to some extent, and so does pollution. But we've seen that even during the summer months, when we had the peak of summer in India, there was really no decline in number of cases in areas where the temperature even went over 40 degrees. So that may not play that much of a role. As a matter of fact, now with the temperature coming down across the country, it may actually lead to more spread of the infection. And of course, in the Indo-Gangetic plain, air pollution also does play some role, because there is data which suggests that pollution leads to more severe COVID infection and can also lead to increasing number of cases.
Yeah, but Dr. Guleria, I wonder what the plan is, because we are continuously unlocking and our plan of unlocking is irrelevant to what is happening with the numbers. So do we have a strategy in place? Are we planning to even control coronavirus in India like Taiwan has, like South Korea has, or are we just waiting for herd immunity to kick in?
No, I don't think so. At a policy level, there's a lot of aggressive action in terms of testing, tracing, and trying to sort of isolate and track people. The problem that I foresee is that for any policy to really work, it has to have cooperation from society, and it has to have some degree of faith among the people who are implementing it. Currently, the two parts are there, but the involvement of society is not as much as one would have liked it to be. I can understand that there is a COVID fatigue which has set in. People are fed up of sitting at home and want to move out. There's also an issue of the economy or livelihood, as I mentioned. But I think it's important for us to understand that we have to strike a fine balance between the two. And I think maybe we need to be a little bit more aggressive, strict in trying to make sure that people really uh, have this appropriate behavior. We make sure that we don't have crowds developing so that we don't have super spreading events. We continue to aggressively test people, uh, track them, isolate them, and make sure that we develop containment zones so that the infection doesn't spread to other parts or other regions. If we are able to do that, we will be able to bring down the number of cases. Overall, the number of cases in the country are showing a downward trend. The challenge is to sustain it. And that is something that we need to do. Waiting for herd immunity to develop is not going to be a solution because, as you've seen in the zero surveillance, currently the number of people, even in a city like Delhi, who are having protection is actually just about 25%. 75% are still susceptible. And that's a huge number, and that will cause a huge strain on the healthcare system and will lead to a large number of deaths also.
There is so much hope on vaccines right now. We know that the Pfizer vaccine has 90% efficacy. The Moderna vaccine claims it has 94% efficacy. What is the kind of timeline then do you see for the end of COVID-19 impacting our lives the way it has in light of all of these vaccines?
So, like I said, when we're looking at timelines, there are two timelines. One timeline is when will the vaccine be available? Vaccine will be available by early or let's say the beginning of next year, the first 2, 3 months of next year. Based on the number of doses that are available, we will prioritize it and one will give it to those who are having a chance of dying because of COVID-19 to decrease our mortality, and for to those who have a chance of getting the infection, are more susceptible, are more or those who are can get the infection because of their occupation or the work that they do. Gradually, as the number of doses increases, we will be able to vaccinate more and more people, and then we will have a situation where we could say that there would be herd immunity. That may take a longer period of time, but once we're able to vaccinate the high risk group or some degree of people who have a higher chance of spreading the infection, the number of cases should come down substantially, and we should reach what we would say is a new normal. But to say that when will we have no cases of COVID-19, when will the WHO declare that the pandemic is over, that is not something that is going to happen in the next 6 months, even if we have the vaccine by early next year.
All right, so it's another at least 6 months away, if not longer. Tell me about the vaccine, Dr. Guleria. Well, everyone's very excited about it, and it's well known that your high priority and most exposed people should get it first. Does everyone have to take the vaccine? Is it important to?
So the important issue to understand as far as vaccine is concerned, it's a voluntary thing. And that is why there is a huge, it's very important that we are able to educate people about the importance of the vaccine, and sort of ask them to take it. We already have adult vaccines available, and we also know that the vaccine immunization is something which is done frequently in children. In our country, most children get themselves vaccinated, but there are certain areas where parents are not willing to get the child vaccinated and say let the infection happen on its own. So vaccination is something which is voluntarily, but I think considering the fear that people have due to COVID-19, and if there is a proper information provided about the safety and the efficacy of the vaccine, I would say that majority of people will get themselves vaccinated.
All right. Thank you so much, Dr. Guleria, for taking out the time and speaking to us, helping us understand how the COVID situation is unfolding in India. We'll take a very short break at this point, but India Revival Mission, a special programming on the other side. Don't go away.